That is the amount of money that Trump and his Congress have cut from Medicaid over the next 10 years. That's $10 billion a year, and that translates in Indiana to somewhere around 250,000 people losing their Medicaid coverage, and that translates into somewhere around 1,000 Hoosiers dying every year needlessly of treatable diseases. So that's 2 or 3 people every day are going to die because of these cutbacks in health care. And some of you have heard this allegation that when Congress passed this bill, they were so clever that they delayed most of these cuts until after the election in 2026. However, I see lots of nods. People have heard that. That's bullshit. That's not true. They'd like to think that because it's more dispiriting for us to believe that. But these cuts are taking effect already, right now. For instance, the Crossroads Easterseals clinic in Indianapolis that takes care of disabled children, about 300 disabled children every year, announced a couple of weeks ago that it's closing on September 30th. It's closing. Disabled children. Oh my God. Bartholomew County Hospital over in Columbus, Indiana, on June 30th, it announced that it was eliminating 50 positions and several programs because hospitals, even if their cuts don't come for another 18 months or whatever, hospitals have to budget ahead, several years ahead. And so we're looking at somewhere between 10 and 20 Indiana hospitals, pretty much all in small towns, that may close in short time. Hospitals closing. And you think about a lot of these hospitals in rural areas, they may well be after the second largest employer after the school system. So people are going to lose their jobs. Patients are going to have to travel farther to get health care. All these barriers are going to come up for the most vulnerable amongst us. Indiana already ranks as the 3rd worst state in the United States in terms of maternal mortality. So that means death during pregnancy associated with childbirth. Oh, thank you for that applause. I love that. So people are going to have to travel farther for their obstetrical care. And we already saw this happen just down in Lawrence County, in Bedford, where the Ascension Hospital system closed its hospital down there called Dunn Hospital, which had been there for decades and decades. And so OB services from Lawrence County are already gone. Paoli faced loss of their OB services, and they may face that again. I could go on and on, but I better kind of rein it back in. So where is there any room for hope? Okay? What can we do? We're not hopeless. We're not helpless. Now, one thing that has been brought to my attention recently is because we've been looking at Medicare and Medicaid numbers, and I haven't even said anything about Medicare yet, and I probably don't have time to today. Now Monroe County is kind of a special thing because we've got lots of students who are covered by their parents' insurance. We've got lots of wealthy people with jobs that have health insurance. But in most Indiana counties, if you look at the numbers, the number of people who are on Medicaid and the number of people who are on Medicare, most Indiana counties, they're about 50% or greater, are already receiving health insurance sponsored by the government. And if you add in there people in the VA, which is getting ravaged, and if you add in there the Affordable Care Act people on the marketplace, the Obamacare marketplace, I was going to mention this earlier, people in that program are looking at probably 75% increases in their premiums next January. Another thing that's already happening, and the big health insurance companies have already predicted going to have significant increases in their premiums. So this is just all getting worse. But back to the people all across the state of Indiana already have government-sponsored, government-supported health insurance. We need to find ways to help them understand that, so that how all of this affects all of us, and therefore that they should vote accordingly, because this all affects all of us. Okay? Yeah. One last thing. So I've talked about these kinds of coverage issues, and I haven't even mentioned what's happened with the Department of Health and Human Services, Bobby Kennedy Jr. Yeah, give me a good So, I mean, first they massacred the National Institutes of Health and cancer research and all sorts of things. Then they massacred USAID and care across the world, particularly for things like tuberculosis, malaria, and HIV. And then they massacred mRNA research, which is not just vaccine research, it's also cancer research and all sorts of things. And then now most recently, they are trying to massacre the CDC. Who can tell me what CDC stands for? Center for Disease Control. It's being ravaged and massacred right now. And when you look at the data, Scott County, Indiana, where some of you know, they had this HIV outbreak. Local people played a big part there, but the CDC played a huge part in coming in and supporting local care to end that HIV outbreak. So, I really got to wrap it up here. The feelings that we're feeling of anguish and depression and despair, those are real feelings. We can't ignore them. But we can stand up to them. And I love, there's a sign back there that says, "We may not be the land of the free, but we're still the home of the brave." We need courage. These are dark times. Some of the things that are broken are not going to get fixed. There's going to be a lot of work to do. But we've done things like this before. This is a fight for our lives. I'm talking about, when I say we've done things like this before, I'm talking about the Revolutionary War. I'm talking about the Civil War. I'm talking about we helped bring a peaceful end to the Vietnam War. We've got to work. We've got to get everybody involved. We're all in this together. And when we talk, yes. And when we talk about health care, one of my favorite mentors, Dr. Quentin Young, used to say this, and we will chant this all together. Everybody in, nobody out. Everybody in, nobody out. Everybody in, nobody out. Thank you. Carry on. Solidarity forever.